Hi, I'm Dr.Rashmi Yogish, IVF consultant, Khushi Fertility and IVF Center, Bangalore. Difficulty in conceiving the second time is not an unusual thing. A lot of people find it very easy to conceive the first time. A few months after they start trying for pregnancy, they conceive naturally. They're able to face the pregnancy very smoothly for all the 9 months and also deliver normally. But then, when they start trying for the second child, they find it extremely difficult. This is what is called as secondary infertility. Some women, however, find it very difficult to conceive the second time after facing an abortion. That creates a lot of psychological agony in the minds of young couples who are trying to have a child. Usually, secondary infertility or inability to conceive after having conceived once is because of certain anatomical abnormalities that come either in the uterus or the fallopian tubes secondary to infection, post an abortion or a miscarriage. Usually, there could be some kind of inflammation in the fallopian tubes or adhesions in the fallopian tubes created. There could be some pelvic adhesions around the uterus, tubes and ovaries secondary to infection that makes pregnancy difficult. Sometimes post a curettage of the retained products of conception after an abortion, there could be adhesions inside the uterus that makes pregnancy difficult. Fortunately, problems in the uterus and problems in the fallopian tubes can be tackled. Usually, if it is adhesions in the uterus, a hysteroscopy can be done. Adhesions in the uterus can be lysed, and then with a few hormonal medications, the endometrial lining can be recovered. The toughest challenge is when the fallopian tubes get blocked. If there are minor adhesions, with a simple hysterosalpingography, sometimes these adhesions get cleared and then pregnancy is a possibility very soon. However, if there has been an infection or an infection that occurs not because of the abortion but due to a vaginal infection that spreads to the fallopian tubes post the abortion due to reduced immunity, the fallopian tubes can sometimes get blocked, and even a cannulation which opens up the fallopian tubes temporarily might create a patency of the tubes, but the functionality of the tubes can definitely get compromised, because of which it gets difficult for them to conceive naturally or with the aid of intrauterine insemination. Usually, whenever the fallopian tubes are not able to function properly, IVF is the only rescue. Therefore, the infection poses a very great risk post an abortion, and it's very important for women who have a miscarriage that they take care of themselves during the 3 to 4 weeks post an abortion phase, along with antibiotics and also personal care to prevent a vaginal infection post an abortion. Therefore, we always instruct all women to avoid pregnancy for a couple of months after an abortion and also avoid sexual intercourse for a few weeks after an abortion so as to prevent infection that can come from the partner. However, sometimes the abortion that results in secondary infertility could be a different thing. Sometimes the abortion itself can pose certain risk factors to the lady's life.